key role in bringing down costs. How are you customizing this for the market here in India?
Well, I think it's probably the most exciting market, in fact, around the world, largely because, as Dr. Panda said, we have tremendous needs across the spectrum, both in preventative care, clear through the acute care settings. But what is also not lost on a company like ours is that it is a consumer-driven market. It's one of the most unique features of this healthcare system. While we know it has lots of issues associated with that, it does in fact force everyone to try to drive for the right behaviors, because the patient does need to have the right experience, they need to be able to afford it, and they need to tell their family and friends about it if it was a good experience and a good outcome. That being said, I think we have obviously started 25 years ago in India. We now have over 1,600 engineers in India focused strictly on the healthcare development needs. And we're looking at this in a completely different way, which is instead of taking a high-cost system like Dr. Panda mentioned, a cath lab, one of the most expensive systems, and trying to strip it down so it's more affordable, we actually go to the other end now and start from the ground up and say, in the relevant needs of what we're trying to do or what needs to be done, especially if we go outside of the tier 2, tier 3 models, and add the things that are most relevant to the care of those patients so that it can be affordable. And I'm really excited about this. And as I said, I think while we've done quite a lot, there's a tremendous amount left for us to do and really disrupting the way we would have thought about things, not even that long ago. The other big piece of that is how to make something that is more connected. Okay. And I think the information technologies, how we'll connect sensors on bodies, how we'll connect the continuum of care throughout someone's life cycle. Lots of money going into this across the world. But again, I think about the nexus between telecommunications, a very ubiquitous platform in India, with the healthcare needs. This is the place that we should be the innovators for the rest of the world, in fact. And that takes the cooperation of the government, the provider community, the insurance community, as well as technology. Right. And the other piece of that is we have a limited amount of expertise. And I think we're looking at now technology which is fundamentally able to be task shift to someone else, because again, in the rural markets, there isn't going to be a Dr. Panda available to those citizens. So we need to have ways in which we can bring that kind of expertise, extending it through virtual technologies, and therefore provide better quality of care. It's not just a low-cost care, but let's have quality along with lower cost position.
That's